Republican Congressman David Camp of Michigan planning to attend the summit on Thursday. Congressman Camp, are you going into this with any expectations that your ideas, your thoughts about health care reform will find a friendly venue?
Well, hi, Contessa. Well, it does make it a little difficult that the president released this 11-page summary, which really is the Senate plan, but spends $100 billion more and has a new tax in it, just days before we're to meet with him and share our ideas. And we do think the focus ought to be on how we get costs out of health care, and we ought to talk about ways how to do that. And the reason I'm going to the summit is because this is an important issue. The American people would like to see reform, but they don't want to see the bills that the Democrats have put forward. This is just more of the same, big, expensive, cutting Medicare, raising taxes, increasing the debt. I think what we need to do is really take a common sense, step-by-step approach and try to find those areas where we can start to bring costs down in health care.
You know, it's interesting because there certainly is common ground. One of them is the agreement that most Republicans and Democrats seem to find on the fact that that health insurance companies should not be able to without hand discriminate against those who are already sick, that you shouldn't have these controls on pre-existing conditions. When you're talking about what Americans want out of health care, though, Newsweek says it's true what you say, that most people don't necessarily like the health care reform plan when it's called Obama's health care reform plan. But if you break out these individual components, you're looking at this, well, then 48% support it, only 43% oppose that. So is part of this talking about the individual components of a health care plan rather than a big, broad plan?
Well, I think you're right. I think one of the mistakes that they've made is there's always been this big bill out there, and it's either take it or leave it. And again, the president, just a couple of days, comes out with another big bill. It's not really in bill form, but a big idea, and it's going to be take it or leave it. And what we really need to do is get to those ideas where we can agree. And I think by concept we should agree, let's start over and let's not have a great big take it or leave it bill. Let's focus on reducing the costs in health care, not how many problems we can solve in one particular big bill.
On that note, Congressman Camp, because I went on your website and you are very specific on calling for lowering costs for health care. How specifically would you suggest we do that?
Well, one of the ways we can do that is certainly by having some kind of lawsuit reform in the bill. They don't have any.
Experts say that affects only about 2% of health care costs. So what other than tort reform, what else would you suggest?
Well, it's not just 2%, because what you get is $54 billion on the government side alone, and as much as 2 or 3 times that on the private side. So it's a significant amount that allows us then to address some of these other concerns like pre-existing condition and others without having to raise taxes or increasing the debt. So it's an important component of these other ideas, and I think that's obviously a very big thing. The other item we have is let people buy insurance across state lines. Have those insurance reforms so whether they belong to an association or they're on their own, they can have a nationwide health insurance plan and not have to just buy insurance in their own state.
Congressman Camp, I appreciate your time today and you sharing your ideas with us. Thanks.
Thanks a lot, Contessa.